Okay, brilliant. Right, we're all set up, everyone. So, good afternoon, all. It's wonderful to see many of you taking part to join us today, and welcome to the CiC's fifth session in our series of physical health webinars. My name is Jake Joyce. I am the physical stream lead here at CiC, and we are thrilled to continue today's series with a webinar on injury and prevention. For those who haven't joined us before, our host for these live sessions is Grant Yule, and with over 23 years of experience, it's specifically more in the rehabilitation, athletic performance and pre-habilitation side of things, certainly does make him an exercise into discussions on prevention of injuries. The aim of this session is to be as interactive as possible, so we invite you to use the chat function to introduce yourselves, drop any comments you've got, post any questions as we go through. We have set a good set of time towards the end for the session, so if you do have any questions for Grant, he'll be able to get through as many as he possibly can. I would also like to add this session is being recorded, so if you'd like to watch it back yourself, or if you do have any colleagues that were unable to attend today but would like to watch the webinar, please just let them know. And now, without further ado, I will hand you over to Grant to get the session started.
Hello again. Today's a big subject matter because I always say to folk, injuries are inevitable. What is the truth of the matter is there's not one person here today that's viewing this, myself included, that's not had some sort of injury that's put us back. The big thing everyone looks at with injuries is they create some mystery with it a lot of times because folk can't answer why they're injured, why it happened, or how do they get it better. So for a long time, there's always been a big focus on rehabilitation. The last 10 years, what we've seen is a massive jump in the science and the understanding that we look at prehabilitation much more focused than rehabilitation. So prehabilitation is how do we shorten or lessen our chances of getting injury. So if we are not doing the correct things before we exercise or do any daily task, we've got a massive percentage increase of our injury risk. What I'm going to do today is I'm going to split this webinar into three. So the first 20 minutes, I'm going to do an overview on injuries, on rehabilitation, on prehabilitation. Second 20 minutes, I'm going to just show you physically, you can join in with this. I'm going to do an active warm-up and show you different elements and why they're important, which hopefully you can obviously take part in doing and follow along, but also just create some understanding of what you're actually trying to do before you do any physical exercise. And the last bit, I'm going to try and open up because injuries is such a big subject matter. I want to leave plenty of space for Q&A, and what you tend to find obviously is that there's a lot of cases where folk have been living with chronic pain and maybe have never got the answers behind what's gone wrong. So from my perspective, I love working on fixing people on the rehab side. I find it really, really interesting because the body's, for me, it's just problem solving. And the most common, I think, my biggest success came from cases from people who had gone to physios and doctors or surgeons and weren't getting the answers of how to recover from their injury, which is very relatable to me because I've had bad injuries myself where I couldn't find the answers to. But what I did find through holistic approach is understanding why the injury occurred, but more importantly, what the source is and how do I rehabilitate so I get back to 100%. The big injury I had was about 4 years ago. So I was, my sport was powerlifting, so I won the national title and I was aiming to qualify for Commonwealth Games. And what was it? A week before going down to the British finals to qualify, I decided to play a game of badminton and I heard a pop in my knee. So I'd torn the meniscus. So of course, at that time, I was used to squatting hundreds of kilograms, but yeah, apparently I couldn't run around a court for more than 5 minutes, which probably just shows that I needed to do more work on my stability within my joints that we talked about in the last webinar. Now, I got to a stage with it where the surgeon said you need to get your meniscus repaired, but that was, let me get this right, that will be March 2020. So you can guess what happened. Obviously, we went into lockdown. Never got the surgery, and I was basically stuck at home with this knee, which I thought, right, okay, I'm going to do my own research. Now, with meniscus tears, most of them don't require surgery. And I thought, look, I've got no choice here. I'm just going to start doing practice what I preach and started doing my own rehab to my knee. And it took a long time, but over 8 months, suddenly all my pain had gone, the range of motion was there, um, and I was squatting again. I was doing everything that I was previously, and thankfully I didn't get surgery on it. So the body is quite wonderful that way. It will adapt. Now, it's not to say surgery isn't necessarily a bad thing, but surgery a lot of times is something that we actively want to try and avoid as much as we can. I always say to folk, before you go in for surgery, try and look at what the actual problem is. Is there an holistic approach that you can do yourself or through with a personal trainer that you can look at the rehabilitation side of things? Because injuries for me is just about locating what type of injury it is, what the surrounding muscle groups are, and what range of motion that you have within the joint or muscle, and trying to improve that. And that is fundamentally something that you can build up through remedial steps from a very basic positioning. I think if you look about 20, probably less, but 20 years ago or so, if somebody had an ACL injury, a cruciate ligament injury, so if they tore the cruciate ligament, especially if they were professional sportsmen, generally that would mean that their career was over. You'd have to go and have a massive surgery on your knee. Now, nowadays, you've got professional footballers, for instance. There's skiers that I know who ski without an ACL in their knee. And that's because the science behind the strength and conditioning has massively improved. And what they've actually realized is that you can build around a joint. You can improve the actual density of the muscle so it will support the joint. So there's amazing cases that you see now that actually most injuries you can recover from. The two types that I'm going to look at is one, what I'd call your passive injuries, your chronic injuries. So postural problems that we have. This is maybe folk that have back pain that resurfaces over and over again. And these are the pains where they can't actually directly tell you the particular incident the injury occurred. It's more on I woke up or I've turned slightly wrong and my back's flared up and now I'm in really chronic back pain for a long period of time. So I call those passive chronic problems. So they're the ones that reoccur. Now they are often going to be postural imbalances that we have. So a lot of the stuff that we did in mobility and stability, your postural imbalances are generally going to be caused from the position that you put your body into repeatedly. So sitting at a desk all day is obviously, we've talked about this, not good for your body. You're closing off your hips and your pelvis, and you're shortening your hip flexors, which is going to lead to pulling on the lower back. You can get flare-ups, and then I mean, everybody knows if you've got back pain, it is debilitating. And quite often it will put you in a really bad mindset. And the big thing with those kind of postural chronic injuries are they can really, really affect every other part of your life, from your sleep to your enjoyment. Like, it will affect your happiness, because if you're constantly living in pain, it's a miserable existence, and that's something that I don't want to see people do. So a lot of these postural imbalances is really the stuff that I've been doing in the other webinars on how to correct them, understanding how your body works, and doing the work so they don't return, so those injuries don't occur. The second one's your impact injuries. So they are the ones that you're aware of, of when it happened, because you either heard something pop, click, there was some sound, and you went, oh no. That can be an impact injury. It could be a fall, a big twist or turn where, yeah, there's something directly happened where you are like straight away going, I've done something here, get a doctor. Or, and that's where normally a lot of times you'd have to go to hospital, you'd have to get X-ray, MRI. That's quite a lot of times potentially something that's going to have to require surgery because something's gone wrong there big time. So I work with both, right? I would say there's not one client that I see that doesn't have some form of postural imbalance. That's like every human. It's the ones that I look at that maybe have had those chronic pains come back, and I want to make sure that they don't have to live through that. Now, that's kind of connected to what we're talking about on the prehab side. So prehabilitation is trying to do the things in advance of us getting injured. we're really bad as humans is that we're only generally proactive when something goes really wrong, especially with injury. So if you get somebody who, let's just say, breaks their leg. If somebody's broken their leg and they're in a cast and they're in a really bad position, and the physio goes, you have to do these exercises to get your leg strength back. You're going to do them because you're going to say, right, I've got a broken leg. I need to get the recovery there. I want to get back to what I was doing before. That's great. Now, if somebody's got postural imbalances, a lot of time, if they're not living in that pain at that moment, the chances are they're not going to do the corrective exercises to help them prevent that chronic pain coming back. When the chronic pain comes back, they might be then going to a physio or going to a doctor or working with pain medication to try and get over that pain. And then once it's gone, they ignore it, they let it go until it comes back again. And then there's a horrible cycle. And that's where it can affect your mental health as well, I think, because one, living in pain is exhausting. Two, it's going to obviously prevent you from doing maybe the things that you enjoy, the things that you love, whether that's in sport or just in daily, activities in life, So I want to make sure that through these webinars and through the programs that I do, we're going to build a really good understanding of how the body works, but more specifically how your body works, and create an understanding. Because if you've got an understanding of how your body works, you're going to know what exercises that you need to do to make sure or prevent yourself getting injured again. So what we're going to look at now is we're going to look at what prehab looks at and what imbalances are created. So a big one we've kind of covered in the webinars is for people that work at desks, for folk that are sitting down a lot of periods of time. So a really common thing is if you've been sitting at a desk for 8 hours, you finish your shift and then you say to yourself, right, I'm going for a run, I'm going for play 5 sides, I'm going to do something active. Now, what you've just basically done to your body is your body is seized into a position at a desk, and now you're going to ask your body to go and do something dynamic, which your body's not been prepared for. So you're putting yourself in a really vulnerable position to get injured. So for me, and this is where we're going to kind of connect it to, I'm going to look at the lower body and what we look at when we kind of warm up and why we actually do it. We're going to connect our mobility and our stability training and bring it together. Your warm-ups or your prehab work is where I preach it doesn't need to be long. We're just doing enough to make sure that our bodies are prepared for what it's about to do. So sitting all day, then going and doing something active without warming up properly is going to put you at such a higher risk of picking up injuries, or also not performing at your highest standard, your level. So what we look at here is, if I'm just come up from the desk, I'm going to move my chair out the way so you can see what we're going to be doing here. I'm going to connect, I'm going to bring this down to a nice low level. I'm just going to start on the mat here. Now I'm going to connect mobility, stability, and a little bit of strength training or core activation to make sure that you're in the best position possible here. And it's going to take me 5 minutes. Okay, that's as long as you need to do this properly. So get a bit of understanding. You've been in a seated position. Your hips are now going to lock into flexion and extension of the hip. So extending your legs out, your knee up and down. That means that your hip flexors have shortened. The hip flexors in the front portion here. Hip flexors are connected into the pelvis. That is going to then affect the position that your pelvis sits in. So if we have a muscle that is in over-contraction, it's going to pull on the pelvis and tilt and cause anterior tilt. That's then going to make sure that all those lower back muscles are in a contracted state before you've done anything active. So your body's already in this tightened, contracted stage. What we need to do is make sure that we're doing exercises that can relax those muscles so the pelvis can sit back into a neutral positioning, and then we can work from there. So really quickly, you're not going to see my face here. So I want you to actually focus on my foot and my hips, and you can please follow along. I'm going to start my right foot forwards here. I'm on my left knee. Now I've just got a mat here. You can pop a pillow below your knee to help you here. I'm going to do some what we call is hip oscillation. I'm going to clear out all the gunk within the actual hip joint itself. So I'm going to trap my foot. Now, I don't want the foot turning on the side. I'm going to do a gliding motion. So the knee's going to pass my arm. I'm going to pull away from the midline and pull back. So it's a nice big circular motion. Now you do roughly 10 of those nice easy circulations. Now you don't worry if you can only feel that your knee's going a little bit past your arm. Every time you glide back, I want you to be nice and relaxed and just try and create that range of motion through your body. Now, what we're doing here is we're clearing out the fascia within the actual hip capsule itself. So fascia is a build-up of any space or excess space that isn't being used is going to go to waste. So fascia will build up and it will means it will lock your hip in position and not allow its normal articulation to occur. Once I've done 10, all I'm going to do is reach across my body, take a big deep breath, and I'm going to rotate round, looking up towards the ceiling, pushing this knee out, keeping the foot flat, and reach back across. Now all I'm doing here is I'm opening up the spine. I'm going to should feel a nice big stretch on the outside of the glute, and I'm going to come across the body. So I've done 10 rotations, and then 10 reaches with the arm each side. Simply put, I'm going to repeat 10 on the left-hand side. So again, keep the foot flat, pass the arm, away from the body, pull back. We're clearing out all that gunk through your joint. So I do 10 on that, and then repeat on the opposite side. Now, I'm just going to do a shortened version here, just to give you the idea of what we're doing. So that 2 exercises already cleared all the fascia out of your hip joint. Now, what you've done there is you've instantly created naturally more space for your hip to rotate and turn. So if you're out running and you're maybe off balance, your body's not already in a contracted state. You've allowed your hips now to move more fluidly and naturally. The second part that we look at is what we did in the last webinar, which was on stability training. So we look at the single side, the imbalances that we have from our left and our right sides. Now, we've all got our stronger side that we rely on. Now, if you're already tight and you go out for a run, for instance, or you play football, these are what you call, they're bilateral sports. They're sports that are using both sides at the same time. When you get fatigued, what you don't realize is your stronger side is going to be working away, no problem. But as you get more and more tired, your weaker side, your gait is now beginning to fatigue, and it's going to beginning to change what gait that you have, right? So that way there's instability, and when there's instability in the body, your injury risk is much higher. So once I've done my mobility on the floor, we do a very simple stability drill. So that balance drill this time is just putting pressure through your big toe and balancing on the one foot. And all I'm going to do is just bring my chest over slightly and reaching my foot back and just drawing it back up and towards my chest. Little pause each way. Now, the action of this hinging motion is making sure my hamstring is engaged, my glute is engaged, and more importantly, my core is engaged here. It's having to balance and stabilize. We talked about the stability training and how the individual connective groups or connective pathways through your body all run through your core, and your core is so important to make sure that you are in a strong position whenever you're doing something active. So I would do 10 of these each side, reaching over, sweeping through, bringing the knee up. Very simple stuff. Again, if you feel your balance is that bad, you simply just have your hand down just to give you a little bit of support. I'm just slowly trying to increase the range of motion as I do that, okay? Now, if we do 2 rounds of that mobility drill, 2 rounds of the stability, suddenly you're going to feel like your body's moving much better. That would take no more than 5 minutes. You can also then do a little bit of strength work. Now, you don't want to over fatigue your body, so I'm not looking to do this to a fatigue state, but we could go into just some very basic squats and lunges. So if I'm squatting, we're going to cover this when we do more of a strength module, but I'm going to look at my feet pushing the floor apart, pressure through the big toe, pinky, and heel, and I want to feel like I'm standing on a loose rug and I'm pulling tension into it. You should feel your glutes engaged there. And all I do and I lower myself into a squat is I'm pushing the floor apart and allowing my hips to sit nice and deep into this position. And as I come up, I push through my big toe and return to my standing position. If you struggle to keep your heels down or get into a deeper squat position, you can just use a little bit of assistance just to reduce the amount of load that's going through your joints, and it will allow you to sit into that nice deep range of motion. And that's all I'm looking to do, is increase the range of motion through my joints and muscles, preparing my body to be in the best position possible. The last aspect you could do is doing your mobility, stability, doing some squats or lunges, and finishing off just with your core, getting some activation. You've already done a lot of activation when you do your stability. You can do a little bit of isolation work with your core. And that again would just require me to do some very basic mat work. So going into all fours, I'm going to use the example we used last time of doing the Superman exercise. So all fours, elbow to knee, and extending out the opposite sides there. And I'm just looking to squeeze through my abdominals, reaching and extending out. And all I'm doing here is I'm making sure three-dimensionally I'm getting all those little important muscle groups around my core engaged. Especially if you've been seated for long periods that day, your core's not going to be switched on. It's going to be in a bit of a lazy positioning. So mobility, stability, strength, a little bit of core activation, 5 minutes, you're ready to go. And you've already, I promise you, put yourself in a position, you've got your slightly more elevated heart rate, your joints and muscles are going to be moving much more fluidly, and you're going to be in a much better position to, one, perform better when you're doing your sport, but two, put yourself in a much lessened chances of injury. Next part we're just going to look at is talking about the other aspects of where or why injuries occur. So we look at performance. So when I look at an athlete, for instance, the things that I monitor, obviously their activity, that's taken for granted. We look at the other aspects though: nutrition, hydration, recovery. That's the pillars that we're going to fundamentally focus on when I'm looking for improving sporting performance, but also decreasing the chances of injury. So aspects like that. So we look at the first one, the actual activity, the differential between undertraining and overtraining. So you need to, it's my job as a trainer, is to find the level that an individual should be training at. I need to look at the frequency, I need to look at their intensity, I need to look at the type of exercise, and I need to look at the duration, the time that they're putting behind it. I need to find what works better for that individual. Everyone's going to be on a different level. It's always the most pointless task is thinking that everyone's going to run off the same level of training. Everyone's different. Everyone has a different recovery rate. So what I look at with that is want to be specific. I need to work on muscle groups that, one, they require for whatever activity they do, but I need to look at the opposing muscle groups. So with runners, for instance, very common injury is going to be through the hamstrings. It's going to be through the calves and the ankles, and it's going to be through the muscle groups which are often forgotten about. Most of the sport that we do as humans is going to be forward driven, so it's quad dominant. We tend to be always very quad dominant. Our hamstrings end up becoming a lot weaker, or our glutes do. So, I mean, actually, a lot of times I'll do with my runners, though I've got plenty to do triathlons and Ironmans, is I want to strengthen their posterior chain. I want to make sure that they're bulletproof from their back down. Okay, I want to make sure that we're doing all those work that really fundamentally are going to support your core and make sure that the weaknesses that you have in your body are going to improve big time. What I then look at the other part with training is what we talked about there is the overtraining aspect of it. Are they training too frequently? I'm a massive believer on quality over quantity. You don't need to be if you're training and you're sore every time, that's not a good aspect to look at, right? That's not something which determines whether you've had a good or bad workout. What we look at is certainly when somebody starts training weights for the first time, they will have that normal muscle soreness. But if you felt like that every time, you're not going to want to train. You're going to be too sore to train. So muscle soreness is not related to getting stronger. It's your body going through adaptation, which has to occur. But once you callous your body to what activities you're doing, the muscle soreness will be there lightly, but not as severely as what you'd have when you first start training. So when I look at training programs, I want to actually look at making sure the quality of the training is there. Why? Everything's got to have a why behind it, right? If you go in and you're doing any exercises, I say to every one of my clients, if you do not know why you are doing one of the exercises, it's my job to tell you why, because everything that I program and put into your training is specific to the individual, and there's a specific reason of why they have to do this exercise. That way, one, for instance, I'm going to create a smaller training program. There's not going to be fluff in the actual exercises or their program itself. They have the knowledge and understanding of why they're doing this exercise and why it's beneficial to them. Three, it's going to save a lot more time because they're going to create an understanding of how their body works, how to move correctly, and then we're going to have much quicker success that way. Overtraining is when we are not allowing our body to do the most important thing, and that is recover. Whenever you train, all the benefits that you get from training are going to be done when you are not training. It's when you've finished your session and when you're sleeping. That's when your body goes through adaptation. So that makes sure that you are getting enough sleep, that you're recovering properly, and that you're hydrated, because a body that is overtrained is quite often a body that's going to be dehydrated. And when your muscles are dehydrated, so is your brain. And that's how, one, that our quality of training will drop, but two, more importantly, your muscles are in a much more vulnerable position to tear. So making sure that they're hydrated properly, avoiding overtraining. So that's not making sure that we're not suddenly going from training 3 times a week doing to 5 times a week straight away, and we're repeating the same exercises with the same drills and the same weights, and we're going to get limited returns that way. Often people think more is more, and it's not the case. It's always the case that we want to look at the quality over the quantity that we are doing, making sure that we're having good quality training sessions and making sure that we have the proper recovery times. And then hand in hand with our nutrition and our hydration, make sure our bodies are recovering quicker, and that the adaptation will happen quicker, and then we'll be in a better position to then get stronger, and yeah, be a lot less injury risk. The next aspect then I want to look at with injuries is just also from the kind of the mental health perspective of how low it can make you feel. That's something I totally understand. It's so frustrating. I was actually talking to one of my clients this morning about it, where she's had just a run of bad luck. She's had bad chest infection, and then she had injured her foot, and complete just a run of bad luck. And she feels mentally that now she's gone from being on a really good level. She's had 6 weeks of bad luck, and she's now right down at the bottom, and that's not the case. It feels like that mentally because she's not in her normal habits, and healthy habits is what we try and achieve. But when that's taken away from you, you feel really low, and it will affect your happiness overall. So having a bit of logic, I was saying, saying this to her this morning, was there's a really quick and easy way back to where you were before. It's just that because you're out of routine, you're feeling like it's the end of the world. Somebody takes your normal habits away, your healthy habits away, your brain does not compute. And that often just becomes that you become a little bit conflicted in your brain and you put yourself down a lot of times. Often then, if you're not exercising, it's going to affect your sleep. You're going to become an overthinker a lot of times, and you're not getting those endorphins that you get when you exercise. So these are the injuries can be such a simple thing to look at logically, but it's every other aspect it can impact, and that's where my kind of empathy comes from for individuals. Whereas, like, if we just have a bit more of a logical path into how do we get over our injuries, we'd be in a much better place. Now, a few of the kind of injury highlights. I don't say injury highlights. I say the more frequent things that I see is it's also trying to remove the fear of some injuries. I think my big burden with certain doctors a lot of times is if you went to a GP, and I'm talking off personal experience, and you went in, say you're somebody who's really active, and you went in with a sore knee, hypothetically. And if you went in with a sore knee, now there's a lot of incredible doctors obviously out there, but there's some that would just turn around to you and say, well, just stop running. And you're thinking to yourself, no, that's the thing I love to do. That's the thing that makes me happy. Yeah, but if it's causing you pain, just stop it. And sometimes you don't realize the effect that can happen, that can have on that person is, somebody telling you the one thing that you absolutely love to do can't do it anymore, right? Again, brings your mental health down because something's been taken away from you. And quite often the case is it's just a matter of understanding how the anatomy works, how physiology and anatomy works, that you can then just do some very simple exercises to stop that knee pain from happening. And strength training, the biggest thing I always say to folk is the best way to be injury free, as low risk as possible, is getting stronger. If you have got a strong core and you're building strength, all those connective tissues around your joints, you're going to always put yourself in a much lower injury risk. When we are not doing the relevant or the important work, our bodies become more and more fragile. And it's just finding the pathway to whatever level you're on and how to get started that way. And it's trying to be proactive. Rehabilitation, being proactive, taking action for yourself, not having to change everything in your life. It's just doing enough to get you started, doing enough that you can stick by it. More importantly, if you just think back to whenever you've been injured and how unhappy it made you feel, you're going to have a lot more, I think, motivation to start. Injuries that get thrown around, a lot of times I'll hear, I'm sure there's plenty of people on here that have had sciatica. And sciatica is a real common one, and folk go and they'll live with it for years. And I look at people with sciatica, and it's the most fixable thing ever. It sounds quite a scary word. I've got sciatica. Oh no, I can't believe it. It's got sciatica. Oh no. And I'm going, yeah, that's just a contracted muscle that's compressing a nerve, and you can release that muscle and you won't have those pains anymore. So here's 3-4 exercises for you to do, and you won't have sciatica anymore. But it's the population of folk that they live in the bubble of living in that horrible pain that sciatica causes, and then thinking, I can't do anything. I'm just not going to move. I have to lie down. I have to take painkillers over and over again. And it's just then going, right, well, this is what it is. This is how to fix it. Do that, and you're going to be in a good place. But it's trying to get, and this is why I'm on here, is trying to help folk create an understanding that there's always a logical path when it comes to injuries, and it's just trying to discover what it is and why it's happening. I'm going to leave it there for this section because, as I said, I think there'll be a lot of questions today on maybe your own individual injuries and questions you'll have about obviously what I've been talking about today, and hopefully I can answer them all. So less than me talking, and I'll let Jake take over and ask me some questions from everything that's been in the Q&A today. Thank you.
That's great, Grant. And you are correct. There are a few questions that have come through already, and we'll get through to them shortly. Just before we do that, though, I'd like to say a huge thank you again for another insightful session. And just a reminder, yeah, if you do have any questions for Grant, please feel free to drop them in the chat or the Q&A section, and we'll go through them one by one. We
Cool.
encourage you to ask anything that is on your mind about your fitness journey, any challenges you may have had with injury yourself, or if you want to just optimize your routine in the prehabilitation way, Grant would be loved to hear from you. And Grant, the first question that we did have then has got a bit of
Yep.
backstory to the individual. They fractured
Nice.
their ankle 4 years ago and have had plates either side of their right ankle. Through pretty much they've recovered fine. They walk strangely without shoes on, and it's impacting them. They believe it's impacting their knee. That they do cycle every day, and I'm not sure if that is also part of the problem. They would like to be good to find out if there's any exercises they can do to help strengthen the muscles/joints.
Yeah, no. Yeah, so like ankles are really complicated, right? It's a horrible joint to injure, so I totally have sympathy for you for that. And well done for like being active again. But I can understand that it can take a lot because there's a lot of connective issues, obviously, with your tendons and how your ankle moves and rotates. And was it Jake? Did you say was it running that you did before, or was it
Cycling.
cycling? Sorry. Um, so yeah, cycling's going to put a lot of impact on that, and I can understand why it's going to affect your gait. So one, yes, absolutely, there's exercises that you can do that's going to help you. Firstly, I would say the easiest, most corrective thing you can do is making sure that you have insoles that you're wearing with every footwear that you've got. Maybe you've already got that. Now, you don't need super fancy custom insoles. You need something as basic as there's a company called Superfeet. I don't work for them, so there's other insoles available, but you can get them for like £30, and they basically make sure that your foot, rather than sitting in this position, creates an arch, and it holds your foot in a neutral positioning. So what it does allow is when you have the heel bone supported correctly, and that is going to make sure that our foot is not then over rotating. It will hold it more of a neutral position and allow natural pronation of the foot to happen. So I would get Superfeet. They're like £30. If they don't work for you, you get your money back after 60 days. I only know that because that's what I've got, and they work great for me. Exercises wise, you need to do a lot of stability work with the ankle. So ankle's first point of contact on the floor. So that's obviously where your gait occurs. If we're having now motion with when you've got plates within your ankle as well, it's probably going to limit some natural movement that you've got within your ankle. So I would, for you, be looking up the last webinar obviously we did on stability. I think it's available now. There's a lot of lower body stability exercises that you can do. I think if you use Instagram, there's a really good group who do similar stuff to me called the Prehab guys. They're excellent. They're all medical professionals. They do a lot of stability work as well. But stability, so build the actual unilateral strengthening of the ligaments, tendons, and joints.
That's great. Thank you, Grant. And the next question came through when you were showing us the stability exercises specific.
Oh, oh, Jake's paused. He comes back. Sorry, Jake, you paused there.
Sorry, Grant, just let me know when I've come back. Sorry.
You've got your back.
Lovely. So I'll start again. So the question came through when you were showing us the stability exercises, specifically when you just finished the floor exercise. Do we need to do some sort of aerobic warm up to get the muscles warm prior to doing these mobility exercises? And the follow-on question is, are any exercises you're showing us to be done at the beginning or the end of a workout?
Yeah, so dynamic, we want to be dynamic in our warm-ups. So we don't want to be doing static stretching when we start. Absolutely. I think when you do your stability exercises, your balancing work, see if you're going from mobility into the stability and say into your squats, just really basic stuff. Keep that going, get your heart rate absolutely up. We don't want to peak it too quickly. But we're basically, when we're doing any of those exercises, we're creating two things. One, we're improving the blood flow supply. So we're getting blood flow through the entire body. But two, we're actually lubricating the joints, and we're creating synovial fluid. Synovial fluid allows your joints to glide. So when you've not got that gliding effect, that's where we're going to limit the kind of range of motion that we have in the actual joint itself, which is where you become more of an injury risk. So it's more increasing the range of motion within the joints and getting your heart rate up a little bit, especially if you're going to do some cardiovascular, is absolutely fine. More importantly, it's actually just making sure you're getting your joints moving properly.
That's great. Thank you, Grant. Next question we have then. So can we use a cushion or pillow under our knees when we are doing the floor exercises to prevent knee pain, or is it imperative for stability that they're directly on the floor? Any alternative movements that don't require being on the knees as well?
Yeah, I just go back to my mobility video that I did 2 webinars ago, Jake. I think that was.
Yep.
It's called mobility. I made sure that every exercise that I did, I gave you a chair or standing alternative that you can do. I know how many folks struggle getting off and on up and down from the floor. Please, absolutely, if you can use pillows under your knees, perfect. No problem at all. But yeah, that mobility video would be great for you to look at, because I made sure that I was doing a lot of the exercises, which I just did today from a seated position as well.
That's great. And just to build on Grant's point, I did put a comment in the chat earlier on with the link to all of
Oh, and Jake's paused again. You
do
paused again there,
apologize.
buddy. You're back.
Yeah, I'm back. Cheers. Apologies for my internet today, everyone. Next question, Grant, was what exercises are best when you have hip pain?
Hip pain is so hip oscillation exercises. We got kind of want to understand a lot of times the complexity with hips is that it's multifaceted. So the planes of motion are great. There's plenty of planes of motion. We need to understand then what type of hip pain it is, where it's stemming from. That's something, if it's chronic, I would definitely try and get to a good physio, let them have a look at it, and they'll be able to give you exercises. I generally will look at the two things again, is increasing the range of motion within the joint. So those rotations that I was doing on the floor, and combined with the stabilization exercises. So actually making sure there's a quality through our sides. Hip pain often is when there's an imbalance. So either there's just could be so small, but just one part of your pelvis is sitting higher than the other side. That's a really common one. That tends to mean that one side's overworking. And then the supporting muscle groups rather than the major muscle groups are overworked, and sometimes that's where your pain will stem from. But if you're really having chronic pains, I'd try and find a really good physio, let them kind of actually isolate the where, the why, and what to do.
That's great. Thank you, Grant. The next question then. Best exercises for housemaid's knee, if you're aware of what that is.
Yeah, so yes, I do. That's really going to be looking at range of motion. So like the knee seizing up in the position. If you're kind of in a seated position, so it's the flexion and extension through your knee. Your knee is, thankfully, is actually a lot more simplistic than the hip. It's a hinging action. So that pain can be often surfaced from if your quads are over contracted and they can pull on the actual knee joint itself. So it'll create that stiffened effect within the knee. Sometimes if there's obviously deterioration within the joint, so similar to folk that maybe have arthritis or whatnot, the best cause for them to do is increase the range of motion through their actual knee joint itself. One piece of kit that I would certainly promote actively is a suspension kit that you can get in gyms, but you can actually buy for the house, called a TRX, or any kind of suspension system. They're essentially just ropes that hang down with handles. What it allows you to do is increase the range of motion, for instance, that you have through a squat or a lunge, with this basically taking away the amount of body weight through the joint itself. So it allows you to have a fuller range of motion and allows your body to strengthen that range of motion over time. If you're having that, again, chronic knee pain, please go and see a physio first. Isolation exercises for your knee joints as well, I'd highly recommend. So a lot of that balance and stability work.
That's great. Thank you, Grant. And then we had quite a few follow-up questions when you mentioned sciatica. So what are some of the exercises you could recommend that would help with that?
Okay, so if you don't know, the sciatic nerve sits. I'm going to stand up. You're going to have to look at my butt here, by the way, so no judgment, please. But just to actually kind of let you understand what happens. So you've got your butt. You've got your glute minimus and your glute maximus. So your big bit of your backside, so your glute max. The strip that runs around the hip here is the glute minimus. Underneath that is the piriformis. So sciatica is often, it was called piriformis syndrome. Piriformis is just a really small muscle. When that generally will get into a contracted state from prolonged sitting, and because you're in a contracted state, the piriformis shortens and it compresses on the sciatic nerve, and the sciatic nerve runs from the base of the spine all the way down through your leg into the calf, into your heel. Now, it is horrible, horrible pain to suffer from sciatica. What we look at first is releasing the piriformis. So if you can look up exercises for improving or increasing the mobility, one of the hip, but two, looking at how do we release the tension from the piriformis. So sometimes you need muscular release. So foam rolling on the actual piriformis itself. You can look that up. Again, Kelly Starrett's great for showing you how to release sciatic pain. What you'll often find though, because once that nerve is impinged, it will set off a chain of events, which will quite often lead to your hamstrings being really, really tight. So folk with sciatica will be able to touch the floor quite often. So once you've actually released the piriformis, you might also then have to look at some hamstring mobility as well. I'm happy to do like a webinar in the future, maybe looking at some of the kind of specific injuries, and we can show you those ones. But that would be my first kind of protocol for you.
That's great. Thank you, Grant. Next question then comes from, again, someone's personal experience. They feel sharp pain when they try to move their right hand backward or swing their hand around, but no pain when they lift it up. The pain is not coming from their shoulder. It's more from like their armpit and at the joint above the bicep. Do you have any recommendations on that?
Can you read that again for me one more time, just so you
Yeah,
know?
yeah, sure. So this individual feels sharp pain when they try to move their right hand backward or swing their arm around, but they don't experience pain when they lift their hand up. The pain is not coming from the shoulder. It's more like their armpit and the joint above the bicep. Is there any recommendations for that region of the body?
Yeah, so we there's twofold. Obviously, if it was specifically bicep, there's obviously, you've got to look at the tendons, which connects muscle to bone. So there's the head of the bicep, which connects into the shoulder. And the first thing I would kind of look at is, when we talk about like there's 3 rotator cuffs in the shoulder. The most common one we get is that impingement in the front of the shoulder. You're obviously saying it's not stemming from there. If it's the armpit, there's the teres minor back here, which basically connects into your lat, into your upper back here. So the tension often is built from here. So if you have that forward shoulder positioning, you get a lot of contraction happening through the teres minor. So actually looking at stretches through your upper back, your T-spine. Again, if we look up the mobility video that I did 2 webinars ago, I do quite a bit of the mobility on the upper back region, the T-spine region, and try and mobilize that. If the teres minor, like the piriformis, is in a contracted state, it might need manual release from physio, if it is that. But again, if you're living with it chronic, try and find a good physio for them just to actually identify it.
That's great. Thank you, Grant. Next question then. I love running, but over the years I've struggled on and off with tendonitis in my ankle. I've just started a half marathon training plan. What is the best thing that I can do to stop the inflammation happening again?
Strengthen, strengthen, strengthen. I would understand what tendonitis is. So obviously, tendonitis, tendinopathy, inflammation of the tendon, which is caused by overcontraction of surrounding muscle groups. So if it's in the ankle or Achilles, then it's often going to be related to how overcontracted the actual calf muscles become, and also the tibialis anterior, so the shin muscle that runs up the front of your leg here. You get the spongy bit beside the shin bone. I specifically work with ultramarathon runners who have suffered with a lot of tendonitis through their ankles. The first thing I did on them was looking at tib anterior exercises to strengthen that. They also got a little bit of acupuncture work to release the muscle. Always remember your calf muscles are the first impact muscle group of the lower body, especially obviously with running. It's micro impact, so it's that repetition that it goes through. That's why the kind of tendonitis will flare up. What we need to look at is, even though your calf muscles or your tib anterior or the soleus won't necessarily be complaining at you, they might just be over contracted, and that's then creating the tendon flare up from happening. So I would try and bulletproof your calf muscles and the tib anterior. So I would maybe look up some exercises for that. And again, some manual release is really good for that. Actually getting a physio, getting their thumb in and getting some sports massage and trying to release those muscle groups. Once they're released, then I'd be looking at plantar flexion, dorsal flexion, plantar flexion to actually strengthen the tib anterior muscle.
That's great. Thank you, Grant. So the next segment of the body, I guess, where we've had a lot of questions on is in and around the elbow. A few individuals were discussing about the cracking element that they've had. Another individual has just talked about the chronic pain related to tennis elbow. Do you have any recommendations for that region of the body?
Yeah, perfect. Most common one I get. I probably deal with it like every week with folk, and I've had it. It's horrible. So differential there. So tennis elbow, golfer's elbow. It's the only differential is it's at the inside of the elbow or the outside of the elbow. This is going to sound identical to what I just talked about, the calf muscles. So it's because the tendons going to be related to what the first impact point of the upper body, so your extensor muscles of the forearm. So the most common one I see and why folk have this pain is what tendonitis is repetitive strain injury. And so your forearm muscles, like your calf muscles, first impact point, and they generally don't complain when they are in a really tightened state. So the first thing I'll do is, sorry, funny angle here to try and show you my forearm here. So your tendon is going to be either there, and there's one there on the inside. So if I press, I'm going to work on the outside here. If I just find at the elbow joint, and I should be able to squeeze the actual muscle itself here. Now, if you find the middle of that muscle and then press your thumb down, you're probably going to feel a pretty sharp pain running down to your fingertips. Now, that's a clear sign that the forearm muscles themselves are over contracted and need to release. So I'll actually keep that pressure and I'll create rotation within the actual wrist and work through ranges of motion with that. Why it happens more often than not is folk that work at computers. So if you're working at a computer all day, a lot of times your wrist is in this constant state of flexion, which means that the extensor muscles up the forearm here are contracted, and that's what pulls on the actual tendon of the elbow. It's called golfer's elbow and tennis elbow originally because it's also that repetitive action if you were swinging a tennis racket or swinging a golf club, where you're isolating and doing a repetitive action over and over again, but it's inflammation of the tendon that's created, and it's again find the muscle group. So I'd be looking up forearm stretches and also manual release of how do we get the tension out of the forearms themselves.
That's great. Thank you, Grant. We have time for one more question. When I do Bulgarian split squats, the leg that is up on the box causes me great pain in my quad, but only happens to their left leg. Would this be down anything to do with their form?
Just on it's pain at the quad.
Yeah, correct.
Yeah, probably you probably got too much tension in your quads. You probably find again the if you look at your quadriceps, four muscles that are working there, they are the hardest worker of the lower body. So they can become over contracted and cause knee pain itself. What I would suggest with Bulgarian split squats, you're going to get me again moving in funny places here. I don't mind. Sorry, I'll show you. So Bulgarian split squats, we look at the actual distance, and there is different variations in terms of how far out that we step. I'd look at the height of the box that you're actually using. I'd play with that. So higher the box, the more contracted your quad's going to be. Or more contracted your quad will be. I'd maybe start with maybe a lower bench and see if you're getting the same pain through your quad when you do it. The second part then is the distance that you're doing it from. So the narrower the stance, the more the quads are going to work. The further the stance out, it's going to become more glute and hamstring focused as well. So I always get my clients to sit on the edge of a bench and they put their leg out straight, so they're on their heel and they step forward. What that does is it actually measures your leg length. So it puts you in the right distance once you put your foot up on the bench into your Bulgarian position. Here is that you're not putting too much excess strain on the back leg. I would start with that and see if that gives you any help or relief.
That's Grant. Grant, that's great. Thank you, Grant. And I'd also like to say thank you to everyone for your thoughtful questions and active participation today. We do hope it was an hour of your time well spent, and we do really apologise we wasn't able to get through all of your fantastic questions. Before we conclude, I did put a small 2-question survey in the chat earlier. Your feedback is really important to us, and we appreciate any additional comments or suggestions you might have for any future webinars. For those that aren't aware, our next physical health webinar will be a dual webinar with one of our specialists at CiC titled Mental Fitness Through Physical Activity. This will take place on Tuesday, the 29th of April at 12 o'clock. So it'll be another opportunity for you to attend and ask your questions, and the details of that webinar will be released shortly. We look forward to seeing you there as we continue to explore more ways to maintain and build on some of the progress we've made through these physical health webinars already. We will also automatically send out an invite to the 6th session for those that have attended today. However, if you would rather opt out for future correspondence, please just let us know. Thank you once again for joining us today. Thank you, Grant, one final time, and have a great afternoon, everyone.
Yeah, thanks everyone. Hope you enjoyed.